Good evening, all. My name is Kumara Sidhartha. I'm a physician and a public health nutrition specialist. I've been with Cape Cod Healthcare for the past 22 years. And welcome to our wellness trails. And today's topic is discussing the top 10 nutritional strategies to support prostate health. And this is part of our prostate cancer awareness month events for this month. So we'll get right into it to discuss the different points related to the strategies. This slide captures the first 5 strategies, talking about number 1, choosing predominantly plant-based meal pattern, being protective against prostate cancer, choosing dietary fiber, which can help our gut bacteria, and we'll talk about how that connects to improving prostate health, and increasing antioxidants in the food, and making sure that we don't have an excess levels of something called IGF-1 level in the blood. We'll discuss that in detail, and also making sure we have enough lignans in our diet, and that is going to be protective against prostate cancer. And then looking at what is called as a methionine restriction strategy in the diet. That relates to a type of a building block amino acid that relates to the protein in your diet. We'll talk about that. And a lot of the initial stages of how a cancer starts relates to what happens to the DNA in the cell's nucleus, right? When there is a damage to the DNA, when there is a break in the DNA called mutation, that's when cancer begins, regardless of which organ that is. So we'll talk about how do we minimize the DNA breaks, the mutations through dietary nutrition strategies, and how do we enhance repairing the broken DNAs. There is a DNA repair mechanism that the body has, and how do we enhance it through food and strategies. We'll talk about that as well. And then it's something called inflammation, and that relates to excess calories and excess body weight, and how it all relates to prostate cancer is something we'll discuss. And in general, some high level point on how do we get these nutrients? What's the best way to get them compared to vitamins and supplements, the whole food approach. So those are areas we'll talk about. So we'll go into the first strategy a little bit in detail. So there has been overall for the past 20 years, there's been studies looking at diet and nutrition strategies and cancer in many organs, and there is a collection of evidence now coming together to show that for prostate cancer, choosing predominantly plant foods, wholesome, unprocessed plant foods for our meals helps to decrease prostate cancer risk, even mortality, and that is having severe forms of prostate cancer, even that leads to death. That risk is reduced when we choose mostly plant-based foods. Even if it's not 100% shift, the more we do that, the better. That one particular study that I'm quoting in that is actually even showed that the fatal prostate cancer risk was cut by nearly half, nearly 50% risk reduction in patients who were choosing more plant foods in their diet. And this is based on a follow-up of nearly 47,000 individuals. It's called a health professional study that was looking at prostate cancer diagnosis and dietary patterns over many years, and that concluded this. So how do we nutritionally improve that, and reduce the risk of this fatal risk of prostate cancer? It's adding more vegetables on the plate, whether it's lunch or dinner, and making sure that fruits are part of our breakfast, part of a snack. If you're choosing snack, choosing fruit is a better way to choose a snack. Choosing grains that are not processed, right? Not white bread, white pasta, but more like a whole grain, unprocessed stuff. And replacing animal protein with plant protein as often as possible, even if it is not 100% switch, as many dinners as possible if we can, choosing plant protein instead of animal protein. So it could be in the form of a veggie burger, it could be in the form of a beans or lentils that is replacing animal protein on certain dinners in the week. So the reference for that is shown in the slide. And so we will move on to the second strategy, where we are looking at how do we increase dietary fiber and what does that do to reduce prostate cancer risk. So fiber has a very fundamental role in cancer risk across the board, not just for prostate cancer. And the way that works is that the friendly gut bacteria that is living in our gut, that depends on dietary fiber. The fiber that is in our food basically feeds these friendly bacteria in our gut, and in return the friendly bacteria does a whole slew of changes that are protective for us, including boosting our immune system to make sure that we don't get cancers. And so the way to improve friendly bacteria's performance in protecting us against prostate cancer is to make sure that our meals have enough dietary fiber. And that includes making sure that we're not using processed foods, junk foods that generally don't have enough fiber, right? Wholesome foods tend to have more fiber. Choosing foods that are high in vegetables, beans, for example, for protein, even for fats. If we choose healthy fats that come in the form of nuts and seeds, it comes with a package of fiber that is already present in the nuts and seeds, right? Rather than fats that comes in an oil that doesn't have fiber in it. So anything we look at food in terms of whether it is fats in the form of nuts and seeds, whether it's protein in the form of beans, lentils, and in vegetables and grains that are unprocessed and wholesome, is going to pack a lot of fiber for us to help with this. So moving on to the next slide, just kind of gives you a little bit of a detail on how this whole fiber element helps with the gut bacteria. As you can see, the top section of the image shows the different nutrients that we eat, including the macronutrients, what we call as the fats, the proteins, and carbohydrates, and the micronutrients that are the vitamins and antioxidants that are in that, and then how that comes through to work with our gut bacteria, the gut environment, to make sure that there is less inflammation, there is better immune system performance to protect us against cancer. So depending upon what kind of choice we make in the diet, whether the diet has enough fiber or not enough fiber, it's going to determine whether one is going to have protection against cancer, prostate cancer, that is when there is enough fiber, and then not having enough protection against prostate cancer when there is not enough fiber in the diet. So, and the third strategy we want to look at is antioxidants. You might have heard of this term. Antioxidants are present in generally colorful fruits and vegetables. And what do? They work to prevent the DNA breaks that I talked about, because every cancer cell starts with the first change that happens is the break in the DNA that happens. That's called a mutation in scientific terms. So the broken DNA becomes a cancer cell, regardless of which organ that is, including prostate, right? So the way to prevent these DNA breaks from happening is to make sure that we don't have a particular component in the cell called oxidants. And these oxidants are high energy molecules. They're like a bull in a china shop. They break the DNA while they're inside the cells. And the way to neutralize this high energy unstable molecule is by providing in our meals antioxidants. The antioxidants, they actually work with these oxidants to make sure they're made quiet, and they pull their energy down to a lower energy so that they don't break the DNA. So that's kind of an inside look at how these antioxidants actually work to prevent cancer. So generally making sure we have enough colorful fruits, vegetables, leafy greens. We're going to get antioxidants through that. Examples are carotenoids, that is in carrots, right? Isoflavones, that you find it in very different colorful fruits and broccoli, for example. Lycopene, that is found in cooked tomatoes. These are just examples of how you can introduce more antioxidants to prevent these DNA breaks from happening. So strategy number 4, we're looking at okay, how do we what else we can do to minimize these DNA breaks, right? So one of the steps that needs to happen for the DNA break to happen is that there needs to be a link or a bridge that needs to happen that attaches these harmful oxidants, these bull in the china shop, right? That high energy molecule, they need to come and get attached to the DNA in order to break it. So these attachments happens through a link, a bridge called epoxide bridges, and there is a way to make sure that we don't have enough of these linkages that is going to attach these high energy molecules to the DNA. And the way to do that is to make sure that there is not excessive levels of animal protein in our diet, because that has been shown to increase the number of these linkages, these bridges that leads to attaching the high energy molecule, these unstable oxidant molecules, to come and get attached to the DNA to break it. So that is another way we can limit the DNA breaks, is by making sure that there is not too much animal protein in the diet. So the source for that is again listed there in the slide. And so the next strategy number 5 is something similar in terms of what we choose in the food. It's again making sure that more often we are choosing more plant protein than animal protein, and the reason is something called methionine. Now we're going to go to a little bit of a basic science here. So protein is if you think about protein like a wall with building blocks, then the building blocks are called amino acids. So these amino acids are used to build the protein, and one of the amino acids is called methionine. And when we have too much methionine in our system, that can facilitate cancer growth. So how do we know this? Studies have been done to look at pulling down the amount of methionine in the diet, and that has been shown to basically take out the oxygen from the cancer cells, figuratively speaking. So the way that we can minimize the cancer cells' activity to proliferate and divide and become bigger and bigger is by reducing the amount of methionine in the diet. The way to reduce the methionine is by basically choosing more fiber-rich plant proteins rather than animal protein. The more we do it, the better. This has been shown in prostate cancer cells to work. Also, it has been shown in stomach cancers as well, so that it just happens in more than one organ where it works to reduce cancer. So methionine restriction is an important strategy to reduce prostate cancer as well. And number 6, we want to talk about something called lignans. Now lignans are a type of antioxidants, and they've been shown to sensitize the prostate cells to turn into a state where these cells, if they are cancerous cells, if they have cancer seed in them, that the body's immune system can kill it off, can neutralize it. So it's almost like making sure there is enough lignans in our diet is going to put a big target on the cancer cells, and for the immune system to kind of come and attack and kill those cells. There is a technical term we use, something called apoptosis. What that means is that it's a selective kind of neutralizing or killing of the cancer cells that the body can do, and eating enough lignans makes sure that the prostate cancer cells are sensitized, made vulnerable to the body's method of killing them off, these cancer cells. So how do we get enough lignans? My simplest advice for patients and individuals is to make sure you get 2 tablespoons of ground flax meal or flax powder every day in your meals. The other source, good source, is also leafy greens, making sure having enough leafy greens, make sure that you get enough lignans as well. So that is looking at strategy number 6. We're moving on to the next strategy is again, how do we, we talked a lot about the DNA breaks that happens, right? There is another way that the body can repair the DNA breaks is through a mechanism that happens in every cell. Each cell we have, including prostate cells, has a mechanism to repair the broken DNAs, right? So imagine that they're like a little tailor sitting in each cell to sew up the torn, broken DNA. We have that in the system. When we eat enough phytonutrients, that are similar to antioxidants, they are present in plant foods, generally in leafy greens. These are called phytonutrients or phytochemicals, and they have been shown to boost the effectiveness of our body's innate repair mechanism that repairs the broken DNA. So there is a way for the body to fix the broken DNA, and eating enough phytonutrients in the form of leafy greens and cruciferous vegetables is going to make sure that these repair can happen faster and quicker, so that a cancer cell doesn't slip through and become an established cancer. So cruciferous vegetables, examples are broccoli, cauliflower, Brussels sprouts, kale. And so this group of vegetables have been shown to be having powerful antioxidants and phytonutrients, as are other colorful vegetables and leafy greens as well. So moving along to the next strategy, strategy number 8. We want to talk about something called insulin-like growth factor. What that means is that it is a molecule that we all have. We are born with it. We need those molecules in order to grow from being a kid to the adult size, and that involves something called growth hormone. And the growth hormone works with the assistance from this particular element that we have called insulin-like growth factor 1. Shortly we call it IGF-1. Now, why is it important is because once we become an adult, once we reach our adult height and size, we don't need excess levels of IGF-1. We don't need growth hormone to be working at that, at its full speed at that time, because if it does, it can actually increase the risk of growing the tumors and cancers at that stage, right? We have reached the adult size. We don't need growth hormone. We don't need this IGF-1 to be, being pumped out fully in full steam, because that's going to grow tumors. So one strategy in strategy number 8 here is to make sure that we don't have excess levels of IGF-1 in the bloodstream. And the way to make sure that we don't have excess levels is by limiting food items that can boost the levels of IGF-1 in the system. We don't need that, right? So that, what are the foods? Making sure that sugary drinks, sugary sweets and drinks that can increase IGF-1 levels. Processed carbohydrates, we already talked about it in the different context of fiber, right? White breads, white pasta, pastries, and things like that. When we do excess of that, that's going to actually increase the IGF-1 level. And also excess animal protein has also been shown to increase IGF-1 levels. So strategies that includes to make sure we reduce the level of IGF-1 is another important strategy when it comes to generally any cancer, including protection against prostate cancer. So moving along to the number 9, this is more of a overall health comment. Generally, when the body has what is called as inflammation, long-term inflammation going on for years, that has been shown to increase many different cancer risks, right? Not just prostate cancer, but many cancers, their risk goes up when the body is going through long-term inflammation. Now, how do we make sure that we don't get this inflammation is by making sure we attack 2 areas in the body. One is to make sure that we don't have excess levels of what is called as abdominal fat or visceral fat. These are fat tissues that are surrounding the intestines, closely inside the abdomen, closely surrounding the intestines, and they pump out molecules that are inflammatory. They create inflammation, right? So making sure that we shrink the size of visceral fat by making sure that we don't eat excess calories, that's going to make sure that we don't have enough inflammation, which can feed cancer, right? So that's a very kind of an important strategy to make sure that we take care of inflammation. The other strategy is just making sure we protect our gut. Our gut health is so important to reduce long-term inflammation. So the foods that we eat, the liquids that we drink, those are the things that comes in contact. That's like the first contact to the external environment, right? Our gut is going to, face our environment through food and water. So the foods that we eat and the liquids we drink, they're loaded with sugar, loaded with too much fats, and processed things and coloring agents and things that are included in certain foods. All of that is going to injure the lining of the gut, and that can provoke inflammation as well. So the two ways you can attack inflammation is making sure not eating too much calories so that the visceral fat is shrunk. And number two, making sure that the choices of food we make are healing the gut rather than provoking inflammation. So moving along to the last strategy, and here is really just kind of a general comment about, we talked about a lot of nutrients, right? We talked about antioxidants, we talked about fiber, we talked about phytonutrients. So one of the misconceptions out there is that, oh, I'll just take a supplement, I'll take a vitamin, and that's going to give me all the things I need. But studies have looked at exactly this question to see, okay, if a patient wants to prevent cancer, if they already have a cancer, can they take these nutrients in the form of a pill, like a supplement or a vitamin, to have a better outcome, to reduce cancer risk or prevent cancer? The studies have more often than not shown that it actually could hurt us in the form of cancer than help us, right? So for some, many reasons that we can't go into today because of the scope of the time. We don't have enough time for that. But excessive levels of packed nutrients in the form of a pill does more harm than good to prevent cancer. So the best way to introduce the many different protective nutrients we talked about in today's discussion, the best way to introduce them to the body is through wholesome food, unprocessed wholesome food, rather than through pills and vitamins. So that's kind of the high level point there. So hopefully you find this to be something you can start to introduce in your regular meal pattern. Even if you don't make every change we discussed, making a few changes is going to go a long way. So I wish you the best for your dietary nutritional approach to protecting yourself from prostate cancer. So now that we have looked at the different strategies on protecting against prostate cancer, let's move over to this table with the display of the fantastic foods that is going to protect us against prostate cancer, so that we can get a first-hand look at how these different foods look. We are looking at a powerhouse of food items here that connects back to what we just saw in the slides, the different food strategies to protect against prostate cancer. So for starters, let's, here, what you're looking at here is the leafy greens. We have in this collection kale, Swiss chard, and collard greens, and they are loaded with phytonutrients that we talked about, and antioxidants and fiber. So all those three elements are going to be helpful for prostate health to prevent cancer. Here we have, this is the flax meal that I talked about, 2 tablespoons a day. Lignans, very powerful to get our, if somebody has prostate cancer, it sensitizes the prostate cancer cell to be taken out by our own body's defense, our immune system. It's called apoptosis. So lignans make sure we do that. So the lignan, 2 tablespoons a day of flax meal will provide the daily requirement in that regard. And then, we're looking at here grains. This is a pasta and rolled oats that are high in fiber, right? So fiber is key. Fiber is going to help us to have a friendly bacteria thriving well, and the friendly bacteria is going to reduce inflammation and improve our immune system to protect against prostate cancer. We're looking at, this is just an example of a non-dairy option, because the protein, we talked about methionine, reducing methionine, which is predominantly in animal protein, and IGF-1, reducing IGF-1, which can also be increased with animal protein. So dairy, for some folks, excessive consumption of dairy can introduce these proteins that we don't want too much of, right? So in that case, we can swap it to a plant-based non-dairy alternative, like this is an oat milk or almond milk and things like that. Here we were looking at, again, colorful vegetables, fruits here, and cruciferous vegetables. We talked about cruciferous as being helpful for phytonutrients to help with the DNA repair for broken DNA. So that's the cauliflower is saying. Berries and protein option, again, seitan is a protein that is made out of wheat. It's a gluten wheat protein. So that is a reasonable alternative to think about for different meals when we are swapping animal protein to plant protein. Again, healthy fats coming from nuts that has the fiber with it, right? Compared to oil, which doesn't have any fiber. Nuts and seeds have fats plus fiber as well. And then beans that are shown here, again, healthy way to introduce protein, but also that has fiber in it, and that can help with the friendly bacteria in the gut, improve our gut health, and improve our immune system so that we can protect ourselves against prostate cancer. So there you have it. These are simple solutions that people can start to introduce to start to protect against prostate cancer. Thank you and all the best.